have Dr. Thozer joining us today to unpack everything that we are going through as breast cancer survivors and thrivers. Dr. Thozer, thank you so much for being here. If you would like to introduce yourself, where you're calling in from, and a little bit about your background.
Absolutely. So my name is Dr. Christy Thozer. I'm a PA and clinician at Corla Health. We are a medical practice where we treat patients for estrogen loss, including breast cancer patients and survivors. Obviously, as you know, going through breast cancer treatment and even after, you absolutely are thrown into a state of menopause, sometimes far before your body is ready for it, and certainly much more suddenly than anyone should have to go through it. So, yeah, I'm really excited to be here and to talk about this.
Great. Thank you. And it's so funny. I'm not sure if I'm like just at that age now, like in my 40s, which I'm just going to totally disclose and throw it right out there. But I feel like all of my friend groups now too are like posting on social media, whether they've had breast cancer or not, about just like the changes that go on in our bodies and maybe a little bit taboo, but no one historically used to talk about this. And now I feel like more and more women are like, hey, I have a voice. These are symptoms and side effects that I don't want to live with. This is really impacting my quality of life and I'm not okay with this. What can we do? So, this is, again, breast cancer related specifically for what we're experiencing, but I'm noticing that more people are being vocal. Are you kind of seeing this trend also from your clinic and practice?
Absolutely. I mean, I think it's fantastic that this is becoming more of a conversation and that individuals are more aware of what is actually going on with them. It's a travesty, really, that the medical community hasn't made that more clear for people what to expect, or even when they're going through it, that it's normal and that there are options for them. So it's fantastic that it is becoming more of an open conversation. I mean, I still think that we have plenty more ground to cover on that, especially with healthcare providers being able to meet patients where they're at with that. I still think, yeah, that there's a lot of room for improvement on that, but just more support and more understanding from from the healthcare providers that, patients I find are all too often being left to bring these conversations up on their own. And how difficult is that when everything else you're going through to bring up, especially sexual health, side effects that you're having from, be it natural menopause or medically induced menopause. That's a huge burden to put on individuals to be the ones to have to speak up and say, hey, this is something I'm going through. And then, it's the next level of, is that healthcare provider going to be receptive to that conversation and have the answers for them?
I was going to say the same thing. Like, I feel like sometimes now it's almost like that checkbox question, like, have you fallen recently? Do you feel safe at home? Is everything okay, like with sexual health? And it's not really like a comfortable environment to like really actually say like, oh, I really want to talk about this. Or have you tried Replens? Like, I feel like sometimes there's just like kind of out of the box solutions versus kind of a more empathetic approach.
Yeah, and a comfortable place to actually have a real conversation. I do find that that's the case even when it is talked about most places. It's very much oh, okay, you've ticked this box that, you're having dryness or, painful sex. Let's recommend this one size fits all solution and send
Yes.
you on your way and not have a deeper conversation about what's going on.
So that's a great opening for, when patients find you, how do you have those conversations? What type of people are coming to your clinics and how do you create that environment where you can actually really move the needle and help support the women that are kind of suffering from low estrogen, vaginal dryness, atrophy, et cetera?
Absolutely. I think the biggest thing is to make it a comfortable space to have those conversations, to make it clear that this is the time, where we can have those conversations, and you make it as comfortable a space as possible for people to feel able to open up about what's really going on. And a lot of the way that we do that is by having much longer appointment times.
Mm,
It's hardly a comfortable place to have these conversations if, you're talking to your medical provider and they've kind of got one eye on their laptop typing notes, and it's, a 10-15 minute appointment at most. It's not a very comfortable space to have those conversations. So yeah,
yeah.
we really build out that space to make sure that people know this is what we're here for. This is what we do. You're not going to say anything that is embarrassing or surprising. And this is what we deal with all day. And we have a whole hour blocked out to have this conversation and really get into, what's going on for you, not a one size fits all, but a specifics of, what's going on with your particular body, what your priorities are, what you've already tried, and troubleshooting a lot of those things rather than kind of slapping a band-aid on it, to be honest. Yeah, but it's a hugely important conversation, and I'm so glad when I'm able to do that with individuals and really work
Yeah.
through those problems in the way that they deserve to be worked through.
Yeah, no, it's such a good point. I was recently at a conference, and I feel like, yes, on one hand, we want to have our primary care and our oncologist and our entire team triage and be able to make referrals and hear where the pain points are and ask some of these questions. But you are bringing up such a great point that people have like 15 minutes to meet with patients. And in this setting, it was like, we weren't being asked about nutrition or diet or lifestyle. And, so much is falling on that primary care, that primary oncologist supporting the patient of like, gosh, they can't even get to their own work if they're asking all of these other questions about, often are you exercising these days or what is your diet like? And plus we're trying to like save you and treat the cancer and all of your side effects that you're going through. And so how do we make those referrals and make time and space for that? I think is still yet to be solved, but definitely something that we're talking about. Let patients know, like, how do we treat that whole person?
Absolutely. Yeah, it's certainly not a, revolutionary statement to say. I'm not gonna be saying anything original here when I say that, the system, the way it's built at the moment, is not doing the best that we possibly could be doing for patients and individuals, and the pressures really are on medical providers to get as many people in and out of their doors in every hour, and it's
I know.
horrible the way it's set up, but, there are so many pressures that the patient is under in that chair. There are pressures that the clinic is under. Unfortunately, this
Yeah,
is the kind of thing that slips through the cracks when that's the way that things are set up. So,
totally.
yeah, it's an
Preaching to the
unfortunate.
choir, preaching to the
Yeah,
listeners, I know. So, when we're diagnosed with breast cancer, we talk a lot about, our identity, our relationship with our body, and having to deal with changes in body shape, losing your breast and deciding if you're going flat, if you're having a single or double mastectomy or a lumpectomy. I know when I was diagnosed, I was in my 30s, I was premenopausal. Chemotherapy put me into what I call medical menopause. And I was in my 30s and we didn't really talk about what menopause actually meant. To me, I was like, oh, I don't have to deal with my period anymore. Like, this is kind of okay. And to me, I didn't really see it as like this longer term life altering situation. And because my chemo was, and also I guess my tumor markers, I was hormonal positive, I was then on hormonal therapies for a number of years to again keep me at that, I guess, zero estrogen baseline, I guess. And this is so fascinating too, because just kind of thinking out loud here, in my case, if my cancer was hormonally driven, it's because there was probably an overexpression and there was more estrogen that kind of talked to the cells and they were dividing and they created this cancer. Is my very simplistic, non medical understanding of the situation. But instead of trying to balance those hormones, it is to completely like go the other extreme. Like you have too much, so now we're going to give you zero. So again, my question to like medical people in general are like, well, why can't we find this balance and why are we going down to zero? But then how important is estrogen in our body? Once it was depleted, I'm like, "Oh my gosh, my cognitive function doesn't feel as sharp. I'm moody for no reason. Like I don't know what's going on." And then all of the physical symptoms that were happening with, hot flashes that was impacting my sleep as well. Like it was this like tornado of just like, gosh, we were fighting cancer, but now we're just dealing with quality of life. So that is like my big like umbrella just to kind of frame this conversation. But are you able to kind of share what actually physically is going on in the body when we deplete someone from estrogen or when they're going through it naturally, even when they have no more estrogen in their body? What's actually taking place?
absolutely. So estrogen is hugely important. I mean, you outlined some of the more obvious things that people notice when they are deprived of that estrogen, especially when that happens suddenly because of, as you said, medically induced menopause. Yeah, estrogen is hugely important. A lot of our focus is on sexual health. So just to talk about what's going on, in that arena. So the epithelial cells, the skin cells that line the vagina and the vulvar tissue, those are really, I mean, to put it simply, they're fed by estrogen. So when
Mm,
that goes away, suddenly that tissue it thins out, becomes more friable, you've decreased blood flow, and all of those things add up to that dryness, that pain, your skin is more likely to rip, really, which just adds to more of that discomfort. Obviously, blood flow is very important for arousal. So you have that stripped away as well. And that's, just to talk, on the sexual health side, that thinning of the tissue, same thing. It has similar effects for urinary health. So,
Mm.
frequent UTIs are really common with this as well. And then you mentioned, hot flashes. Estrogen helps to, it's almost acts as a bit of a thermostat for the body's temperature. So it keeps it, generally in a comfortable range. When that goes away, you're thrown all over the place, not to mention mood changes, bone density issues. There's so much that is completely thrown into haywire when you just remove estrogen
Yes.
so suddenly. So it is a huge thing. And I find that for so many people, they are thrown into that state so suddenly. And obviously, you're fighting cancer. It's important that that is done appropriately, but people aren't being given methods for managing these things, which we absolutely do have. So it's shocking, really, to talk to so many people who are just thrown into this state. They're not given the treatments that we have to manage these symptoms and even to replenish or restore some of that. A lot of what we do is providing vaginal estrogen for patients. And some people know this, some people aren't sure, but obviously, especially if you have an estrogen sensitive breast cancer, the thought of being given estrogen is very scary. That makes a lot of sense.
Yes.
Yeah. But we have many very good studies that show the safety and the effectiveness of vaginal estrogen. So that's a way to safely restore that estrogen directly to the vaginal and vulvar tissue to counteract a lot of those changes I talked about before. So that thinning, drying, of that tissue, we can prevent that and even start to reverse some of those changes safely for people. So if you're on an aromatase inhibitor, sometimes that's a little bit more nuanced. It needs to be a more individualized conversation with your healthcare team. But even for those patients, we have DHEA and many other options.
And
Just
what
covering the
is
surface here, yeah, of course. So DHEA is a natural precursor to sex hormones, so estrogen and testosterone. So we can supply that again directly to the vaginal vulvar tissue, and then your body itself, metabolizes that, converts it into those natural hormones on its own. So even for patients who are on an aromatase inhibitor, and it might be a more nuanced conversation, we found that that's very safe and is a really natural way to restore those hormones directly to the tissue that needs it.
and with the vaginal estrogen that you were mentioning too, how is
Mhm.
that administered? Is that a cream or suppository?
Yes, and it's
Okay.
both and even more. So we have creams, we have suppositories, there's an estrogen ring. There are a lot of different ways that can be administered. A lot of that comes down to a patient preference. Some of it might be a medical decision just based on what's working well for you, your body, what other treatments you're on. But yeah, we have loads of ways of administering that. And often we find that it's a conversation around we start with one thing based on what we think might work well for you, and we adjust from there. Yeah, if you've tried one thing and you're thinking, "Oh, the cream is great. It's inexpensive. It's very effective. Some people find it a little bit messy. So then, something like a suppository might work well for them. So it's really just an adjustment. If you're, depending on where you're having pain with intercourse, if it's a more superficial pain, that'll affect how we're treating you versus, a deep pain, just to give you an idea. But
Yeah,
yeah,
yeah.
there are loads of different methods of application for that.
No, I appreciate that, and kind of figuring out what the patient preference is, I think is equally important, what they're comfortable with. And
Of
so
course. Yeah.
I know we're talking about like, estrogen and kind of rebuilding that back into the body to help the tissue, help the blood flow, help just general vaginal urinary health is what I'm
Mhm.
hearing. But we're
Yeah.
also, I think, confronted with so much like over the counter or different ads of popping up for me because, my Google is just like, oh, you talk about all things breast cancer. How about this? How about that? So, can we dive into where does that fall in the spectrum of like moisturizers and creams and like lubricants and other things that we might be considering or just need education on? Like, when do we use what for what type of symptom?
Absolutely. Vaginal moisturizers are fantastic. If you're having any kind of dryness or pain, I highly recommend them. Even if you are on a vaginal estrogen, I'll often recommend those alongside it just to help to really replenish moisture in that area. It can be great if you are still nervous about trying something like a vaginal estrogen. It can be fantastic to go with a vaginal moisturizer. It's certainly possible that that will do a lot to restore comfort.
Mm.
So, yeah, I think the thing about vaginal moisturizers is, as you said, there's a lot of, you're bombarded with all of this information. You're hearing of this type and that type, and it can be really overwhelming to know where to go from there. You mentioned Replens earlier. That's one that is really highly regarded. We have a lot of evidence that that works really well for people. I think the main thing with vaginal moisturizers is being consistent with them.
Mm.
We recommend, depending on your symptoms, and again, you can work with a specialist to determine what the best plan for you is. But a lot of people, will recommend nightly application for 2 weeks, and then you can slowly decrease from there, but you will still need to be consistent. So 2 to 3 times a week. Sometimes we can taper that down even to once a week. But I think the important thing is just being consistent, not giving up on it. It's one of those things. I think people sometimes can confuse it with something like a lubricant, but it's really important to apply a moisturizer when you're not, planning to be intimate, or at least an hour beforehand, so your body really has time to absorb it.
Mm.
Think of it like applying a lotion. You need to do that consistently and let your
Yeah.
body really bring that in.
I feel like that's like the story of my life, like consistency, trying to get to the gym, trying to do the face mask, trying to do all these
I
things
know.
3 to 4 times a week. So
I
we'll
know.
just
It's
add
so
this.
much easier said than done. I know that. Yeah, the best thing to do really is, if it's helpful, to tie it to another routine that you're already doing, so just, if it's easy to just apply it right after you get out of the shower,
Hmm.
something like that that helps you remember to do it. That's the best way to go. But I know it's so much easier said than done.
Yeah, no, absolutely.
We're all the same way.
So these are some of the like physical tools that we could use to kind of help
Mhm.
with moisturizer and comfort. How do we address the lack of libido? Because I think that's something that we hear a lot too in this space is like, okay, sure, we can work on the comfort side, but we have lost so much like desire, which is part of that intimacy. Does
Absolutely.
that ever come back?
Absolutely. Yeah, no, I
Okay,
I
so
I
there's
hear
hope.
there absolutely is hope. And I think the term libido, or even, the term sex drive, it can be a bit misleading because we think it's this inherent thing, that we all have. And we know that we as humans, have a physiological response to sexual stimuli to some extent. So, to that level, it is a spontaneous thing. But I think expecting spontaneous sexual desire all of the time really leads people to think that there's something wrong with them if that's not what's happening.
Yeah.
So I think giving yourself a bit of grace and understanding that there's a lot that goes into wanting to be intimate. We're constantly doing calculations in our mind, the pros and cons, whether we're consciously doing that or not. Pain is a huge con. Feeling uncomfortable in your body and going through so many different changes, not feeling quite sure in yourself. That's a huge con. There are a lot of things that are adding to this whole picture. So I think what I really would want to encourage people is, there's nothing wrong with you if you're dealing with less of natural desire for sex than you may have previously. And also, that is not a permanent state. There are things that can be done. There are things that we talk about from a medical side to help restore that, arousal and desire. But there's a lot as well in terms of, talking to a sex therapist who's experienced in estrogen loss in patients who have gone through breast cancer or are going through breast cancer treatment, and everything that comes with that. Having an open conversation with your partner or partners about what you're going through and trying to relieve some of that pressure on it.
Yeah.
Again, much easier said than done, but it is absolutely something that, um, there's nothing wrong with you, and there's absolutely things can be done, and it does not have to be a permanent state
Yes,
of being.
yes. And I think you are giving us permission too to say, this is not our fault and there's no blame or shame associated with that. I think that in
Mhm.
and of itself is giving us permission to kind of move past some of the mental barriers that, we may feel or put unexpected, unrealistic expectations on the situation, right? And so
Absolutely.
I think sometimes too, even just saying like, can we cuddle? Can we hold hands? Can we kiss? Can we be intimate without having intercourse at this phase? But then later on, like without putting that pressure on ourselves, where like you have to get to this end result. But can we work in steps, I would say.
Absolutely. And that's absolutely the case. I think being open and saying, "Yeah, can we cuddle? Can we take the pressure off of something that feels like this almost artificially imposed goal line?"
Yeah.
Because cuddling, maybe you get what you need from that. Maybe you get that closeness and what you're hoping for from intimacy. And maybe it's the precursor to having more desire, but expecting yourself to have that out of nowhere and with so much pressure placed on it, that's
Hmm.
a huge hurdle to overcome. So just being honest about what you want in that moment, what you need, and feeling like you can be open and honest about that and also state what you want and need from that situation can really do a lot to make you feel more comfortable and also open things up to progressing from there.
Yeah, absolutely. And again, I feel like we'll title this podcast Easier Said Than Done because it's so true. And we're even thinking too, like if you had breast surgery, I'm sure your partner doesn't want to hurt you. They're getting used to your new body. There's scars. You might look different. And you also potentially have lost sensation in an area that used to be in an arousal area, right? So how do we then now say, I appreciate that you're touching me there, but I can't really feel anything. Like
Hmm.
now we're having intercourse that's really painful. And I feel like the whole like intimacy has been almost like blown up. Like we have to start over. We have to start from scratch. Like we're coming out of this, cancer story as a new person and we can't go back to how we were. And we talk a lot about, I know I talk about it, like I miss the old me. And this is like the 2.0 version and it's pretty
Hmm.
fabulous. I'm not going to lie, but there's still things we need to work on. And so how can we rediscover our body and our personally, like how can I feel in love with myself again after going through everything? And then how can I allow others to love me in a way that I can be receptive to? So,
Absolutely. I think that, yeah, the biggest thing is you said it perfectly there. You're almost starting over. And that can feel scary. That can feel like a big loss. But I think recognizing, okay, let's build up from
mhm,
the beginning. What is nice? What does feel good? What do I want? What do I enjoy? And leaning into those things and just starting there, building up from
yeah,
there. Yeah, it's a huge, huge thing to overcome. But I think being open and having those conversations outside of the bedroom, if you will, outside of those sexual contexts, being able to have those conversations of that I'm not enjoying this. My body's changed. Things that I once enjoyed, I don't necessarily anymore. Here's what I am enjoying. Here's what I do want. And starting from there and just building on those things.
yeah, absolutely. I wanted to ask, it's wonderful if someone is listening to this podcast now or kind of knowing and feeling empowered to have these conversations with their doctors. Even better if their doctors are asking them and being proactive about intimacy, sexual health, vaginal dryness. And so they can start looking into some of these tools that we're discussing. But let's say you're just coming across this and, you've been, I guess, forced into medical menopause. Let's say you are on a aromatase inhibitor. It's been 4 years. You haven't quite yet reached the 5 year mark. Is it too late to start? And what are some realistic um, expectations that someone could expect after starting moisturizers or starting to use estrogen?
It's absolutely not too late to start. Obviously, if we catch it, at the beginning and we're able to prevent those changes, all the better, but it's absolutely not too late to start. And a lot of the way that something like a vaginal estrogen helps to actually build back what was lost.
Hmm.
So it's certainly not too late by any means. And you mentioned something interesting about having those conversations with healthcare providers. I think if anything, just knowing that it is okay to have those conversations, and if you're not met with, a receptive audience, if you feel like you're not being heard by that healthcare provider, you can always find someone else who will
So
be.
true.
Yeah,
Yes, yes, absolutely. So you should never feel shame for asking these questions if you're not getting the answers you're looking for, if you're not getting the time. You were saying you spend an hour with patients, which is incredible. Like find someone who can work with you so that your quality of life could improve.
absolutely.
Novice question. When you're talking about vaginal estrogen, is that the same or is that different than hormone replacement therapy?
It is in the way that people talk about hormone replacement therapy, it is something different.
Okay.
Normally, when people talk about hormone replacement therapy, they're talking about something like, systemic hormone
Mm,
replacement, something you're taking a pill orally or you're applying a cream, to your arm or your thigh. Those sorts of things restore your hormones throughout your body, whereas a vaginal estrogen really is a targeted treatment for your vaginal vulvar tissue. So, yeah, to answer your
no, that's super
question,
helpful. So
normally,
I feel like it's actually not
yeah.
so novel or novice anymore. I mean, that's a really important point to understand the distinction.
Absolutely. Yeah, yeah. No, there is a difference in the way that the people talk about hormone replacement therapy. They're talking about whole body hormone replacement. And yeah, vaginal estrogen is a much more targeted treatment and it doesn't get meaningfully absorbed into the rest of the body, which is why it's such a great option for people who who are sensitive to estrogen in their breast cancer
Absolutely.
types.
Which I think becomes so great that these studies are coming out and showing that this is a safe option for women. When do you think, or are we there yet? I haven't looked recently, but in terms of, guidelines and more medical professionals feeling comfortable prescribing this to their patients?
Yeah. The guidelines are there, but change is slow sometimes.
It is. It's a fight.
Yeah, yeah, it's really unfortunate. A lot of healthcare providers, OBGYNs, the OBGYNs that you're, typically seeing in the office actually get very little training, targeted training in estrogen loss, even
Mm,
for, natural menopause. And that's something that's going to affect 100% of their patients at some point. So it's shocking really the lack of targeted education and training that even, an OBGYN gets in medical school, let alone, you add in breast cancer to that and providers are scared. They're not sure
yeah.
what to
They're not
do, and
exactly. Yes.
it's much easier to say no than I don't know. So that's the reality that people are faced with really when talking to their providers about this. The guidelines are there, the studies are there, but individual medical providers are slow to take those up, unfortunately. You can always work with, if you're still in active treatment, work with your oncology team to, sometimes your oncologists are happy to prescribe, a vaginal estrogen for you or, provide a letter to your OBGYN to give that reassurance that
Yes.
it's safe and everyone's on board.
Yeah.
But
Those
yeah,
are some
I
great
think
tools.
really, yeah. I mean, it goes back to what I said, really, that if you're not getting what you need from your healthcare team, it's always okay to get a second opinion or even just to find someone else who has that training and is more confident in treating estrogen loss after a breast cancer diagnosis. Because for a lot of medical providers, they don't feel comfortable doing that. So it's important to find a specialist and somebody who's comfortable treating you and what you're going through in your medical history.
Absolutely. So I'm all about bringing more specialists into my pocket to help me. I think the more eyes that are looking after my health and helping me thrive, the better. But it also can be very overwhelming. So I want to, we talked a little bit about, your OBGYN, the role that you play, perhaps like a sexual therapist. And I'm also hearing a lot of people who are now seeing specialists to help with like different pelvic floor exercises, right? And
Hmm.
so
Yeah.
who do you need? Do you need everybody? How do we all work together? God forbid, is insurance covering any of this? So, just like those big topics, what can you share on that front?
Absolutely. So it really is going to come down to the individual. I think that having a medical provider on your side who is able to have these discussions with you, is able to figure out what's going on in your body and what you need and work through a really robust treatment plan with you is essential. And having that person on your side to talk to you about all of that and then say, I think that with this, it would be helpful to add a sex therapist into your care plan. You mentioned, pelvic floor physical therapists. They do fantastic work. And for a lot of people, it is also beneficial to have that on board as well. So it really does come down to the individual and what you're going through, what your body is telling you, and
Yeah.
what you need on your side. But I mean, that's a lot of what I love about what I do is I'm able to do that really deep dive with people, create their full care plan, and bring on sex therapists, bring on pelvic floor physical therapists when it's going to be beneficial for individuals.
Amazing. So a lot of support out there. We just need to learn how to access it, how to ask for it, how to advocate for it. And hopefully that, we'll be able to find relief and a better quality of life with some of these therapies and therapists and people's rooting for us.
Absolutely. Absolutely.
Dr.
Yeah,
Throzer,
I
what
think
else? Yeah, tell me, like, what else have we not covered? I'm not even sure what questions to ask that I don't know I should be asking.
no, I mean, it just really, what you said about about advocating for yourself, really. If you need permission from somebody, you may not, but if you need permission for somebody to speak up for yourself and to tell you from a medical perspective, it is, not embarrassing to talk about these things. You can bring them up with your medical team. It's an extremely important conversation to have. And if you're not being supported in that, then that is not something that's wrong with you. That is a problem with the people that you're talking to, really, if they're not able to have those conversations with you. There's no shame in bringing these topics up, especially with a medical team. They're not going to shock anybody, and they're there to support you with this.
Yeah, I appreciate that. I love hearing like there's things that you've already heard. Nothing new is going to surprise you or shock you. I feel like we
No.
should do a whole podcast on like, oh my God, what really do you know and happens and stories you've heard.
Yeah. Yeah, I think, obviously this is what I do. This is what I talk to people about.
Hmm.
For years I've been in OBGYN, and I think the number of times that I can tell that somebody's nervous to say something, they're nervous to bring something up or ask a question. And of course I understand where that's coming from, but I wish I could just tell everybody nothing
Yeah,
is embarrassing here. We can have these conversations. You're not going to shock me. It is okay to ask whatever question you're thinking about asking. It's okay. And it's not embarrassing. You have all the right in the world to
yeah.
talk about all of these things.
I appreciate that. On our website on survivingbreastcancer.org, we have a list of questions to ask your oncologist and your surgeon and your radiation oncologist. We should probably develop one of like, what to ask your OBGYN or what to ask your oncologist about your sexual health and like just have those. It could be like less scary when you're reading from a paper or if you have some questions already like on your phone that you're prepared to ask when you're in there. Because I always say, like, I feel the least empowered when I'm half naked in a Johnny sitting on a stretcher. Like I'm not feeling my best?
No. Yeah, that's no. No, but you're absolutely right. I think having something like that, a list, it's helpful to just read something sometimes. It can make it feel much less scary to say those
Yeah,
words if you're reading off a piece of paper, especially if that's something that has been provided to you from somewhere else. Hey, these are normal questions to ask. These are the
exactly.
questions I should be asking. Um, that can make a huge difference. I think that's a great idea.
That's fantastic. And do you have, I know we talked a little bit about how overwhelming it can be when, if you just Google, vaginal moisturizers or, estrogen creams or all of these things, is there a reliable resource we can direct listeners to, or do you have like medical recommendations or just your expert recommendations on brands or products or things that women should be looking into?
Yeah, I think a great resource is ACOG, that's the American College of
Yes,
Gynecology. That's always a great resource for these things. And obviously everything that you'll find through them is very, very well supported in research. So it's always good to know that you have a really solid source for things like that. Yeah, there are excellent resources out there, and it would be great. I'd be very happy to send along some resources that we could,
yes,
link
please.
below as
Absolutely.
well.
Oh, amazing. Is there anything that we haven't covered that you want to leave our listeners with? I know we have a webinar coming up, which I'm excited to take an even deeper dive into some of these topics, but other things that you want to leave, as we talked about, we should feel empowered. There's no shame. You have permission to go and ask these questions. You have permission to live your best quality of life possible. And that we've discovered a couple of tools and techniques and ways to kind of navigate what happens when our estrogen is depleted. So, what am I missing in our short 40-minute crash course?
I think I would say that you're absolutely right. If you can take anything from this, empowered to speak up and have these conversations, talk to your medical team about this, you have a right to a good quality of life. And sexual health is a huge part of that. That should not be left behind. It should not be, the shameful topic that's put in a corner. Yeah, it's hugely important to know that you can have those conversations. And you mentioned the webinar coming up. We talked a lot about the sexual health side of things here, but there's a whole other, basket of things that people are left to deal with: hot flashes, mood changes, bone density changes,
Mm.
everything like that. So there's a lot to discuss in this. So I'm really excited to dive into that more.
Well, that'll be our teaser, and we'll definitely bring people onto the webinar with that. But Dr. Thozer, this is amazing conversation. Thank you for taking the time to share your expertise, your wisdom, your candidness with our listeners. And I appreciate you taking the time today. So thank you.
Absolutely. Thank you so much for having me.